Heidi, do you want to switch in presentation mode? Oh,
Yeah,
there you go.
do. And then welcome everybody as you're joining. Please take some time to introduce yourself via the chat feature. You can include your name, your organization, and also we're reflecting on why a collaborative approach is important for the type of work we're doing here together. We've got just some takeaway highlights from the recent Collective Impact Forum, their Champion for Change conference up there. While we're waiting, but please go ahead and do introduce yourselves in the chat. We've got lots of people joining here. And thank you, Dr. Nataski, starting us off. For those of you who I might not know, I really probably know most of you. My name is Heidi McPherson with UT Health, and I'm one of the co-leads for the collective.
Then we're stop. You're muted, and you should stay that way.
Hey Heidi, good morning.
Good morning. How are
Okay,
you?
just wanted to be sure you could hear me.
I can.
Okay.
I can hear your voice.
Hey, Glenn.
Good to hear your voice too. Hi, Tim Weir.
Hi, Gwen.
I'm going to be
Sheila.
nice on this call, Tim Weir.
When you're always nice.
Yes, it all shows.
Shall we go ahead and get started?
Yeah, let's do it.
All right. Aloha from Hawaii. Ah, I'm from there. I miss it. Okay, let's avoid the distractions. Welcome everybody. Thank you for introducing yourselves in the chat. For those of you who have just joined, please do take a moment to introduce yourself in the chat there. And here is our agenda. You may have seen it last night. We sent it out. We're going to start with some highlights of our collective progress, and then we're going to dive into work group updates. We'll have some time for some community updates for those of you who are holding events or resources or whatnot. Please feel free to chime in there. And then we're excited to have Leah Barton with Harris County presenting progress on the ARPA investments in our community. And with that, we're going to jump right in. You may have seen our big announcement that Tanwir Kalimala has moved on from Harris County Public Health, and he's also moving on from his role as co-lead. This is a big shift for us. Tanwir has been a part of kind of this trio of Dr. Sharma and myself and Tanwir for a couple of years of having the pleasure of working and leading this effort with so many of you. And we wish him all the best. And we know that in his new role in Episcopal Health, he will continue to blaze trails for health equity and be a partner to so many of us in the work that we will continue to do together. So Tanwir, thank you. I will pass it to Srila to see if you want to add a few words before we let you take the stage, Tanwir.
Sure. Well, thank you. I mean, then we're really it's been a pleasure to work alongside you. The talent that you brought to the team, not to mention the sense of humor and all of the Marvel comics innuendos that came along with it. So really grateful for everything that you continue to do for the community and the work that you did as part of the collective. I know there are many people on this call who've been alongside us. We've been working on this for a couple of years now, and it's just been a pleasure working with you and everybody else. So thank you. And I know we're going to still do our Taco Tuesdays once in a while. So look forward to continuing that collaboration.
I appreciate it. I just have a few things to say. It only took 30 minutes. So if you bear with me just for a little bit. Now, I just, again, kind of like what's already been indicated, I'm still staying here, so I'll be continuing to work with y'all, but I just wanted to say a few things just because it's the last time from this vantage point that I'll be, operating in the region. So I was about to say something about Gwen, but I'm not going to. I'm gonna be nice, Gwen. You said you're gonna be nice, I'll be nice. First of all, I just kind of going with that, I do want to thank Harris County Public Health for the 6 great years. It's been a really great time. It was, for the opportunity and just the work they allowed me to do, and again, to work with a great organization. I am excited. I did have a chance to meet with the Episcopal Health team last week, and so I'm really excited about that. So I'm looking forward to working with y'all from that perspective as well. Just a few things to say. I think just being with the collective for the last several years, I just want to encourage everybody and actually just help me, because sometimes we kind of get lost with the day-to-day, just how much has been done. I'm really proud to work with all of you. You've done such a great job, and I think a testament to a successful collaborative, because there's no utopic collaboration. It's those collaborations that are able to continue despite those who don't want to collaborate. I think that's a testament to what this collective has done. So there's always going to be this organization that want to take the ball home, and that are not, or kind of want to do their own thing. But it's those organizations, their collaborations that are able to continue. So great job. I also do want to recognize, again, I think this has been said, but just again, I wanted to, just from my vantage point, the co-chairs from all the different work groups. And honestly, if you ever looks back, in this sort of last spring, they only have had a solid year at most to really get their feet under. And if you look at how much has been accomplished, it is an incredible amount that has been done. So kudos to all of you who've taken your own time from your own full-time job to do this. And obviously, I would be remiss. I just want to make sure. So with Heidi and Trula, as already been indicated, I've been attached to them at the hip for the last few years. So we have had nonstop text and meetings and whatever for the last several years. And I can say I think I have one of the best places to say you cannot work with people that closely and still feel so positive about them. And that is just a true sign of how awesome they were to work with, not just as people, but even professionally. So I really want to focus on that, because it's for them, it's hand in hand. It's like so enmeshed in who they are. Like Julie, she gets up at 4 a.m. in the morning, and Heidi goes to bed at midnight, whatever it is, from dusk to dawn. They're truly passionate about it. And I really appreciated working with them. And it's a testament to how incredible they are with this work. So I'm in full confidence. I could have left several months ago, and they would have been just probably happier, but I'm just joking. But so as I'm stepping away from this position, I just want to underscore the talent and the professionalism, but just the caring that they have and dedication to the work. So I'm so excited about what's coming and what's already been happening thus far. So I really can't emphasize that enough. Just how, because you work with these people, you get to see how much they put in, how many ideas are coming. And Heidi's only been in her position for not even like a half a year. And so just if everybody can sit back and look at it, she's only been in her position for half a year, and how much she's been able to do it as a full-time position. So I'm excited as, she continues, I guess, on the trajectory to become the executive director of the collective or whatever that is. So Obviously she deserves it, but Heidi, truly, you've done an incredible job, and it's been an honor to work with you the past 3 years. And again, we'll continue to work with one another in this capacity as well. And this is just a couple last points. I know I've already taken enough time. I apologize. This is one thing that just encourage the people who are in this organization, or the collaboration, the collective. I was reminded by this, and I'm reading Anti-Fragility right now by Nassim Taleb, and he had one part related to what Steve Jobs did. A lot of times we kind of get stuck in our own like circles of knowledge and stuff like that. And I think it's important to, sometimes there's other, Steve Jobs, when he created the iPhone, he brought something in that was needed, but nobody realized he needed. And I think just want to encourage that level of innovative thinking. That's obviously another level, but for us to continue to look outside of our own spaces, and to look at places, and to continue to think and bring that type of thought to this. And almost done. Last one, and I'm not going to take away from Gwen's thunder, but I think Gwen is going to be announcing the new person who will be the person who will be taking over. I just want to preview by saying this person has been my sister in arms for the last several years. I've learned so much from her, and I'm just excited about what she's going to be, how she's going to elevate the collective. So with that, I'm going to put the mic down for the next person to pick it back up. So put it back on the table. I didn't drop it. Just on the table gently, and I'm gonna hand it out. So thank y'all very much for allowing me the time. So I'll talk to y'all and work with y'all soon.
Thank you, Tanvir. That was, we should have you on just to, I love all of the praise you're showering on us. No, thank you for everything. And we miss you a lot already. You know that. You get texts from us every day, even now.
Hey, Mom, I'm going to school. Wait.
There's some background noise. All right, I think our next slide is to welcome our new members, and we are very excited. The collective is extremely excited for this announcement, and we'll hand it over to Gwen Sims to make the announcement. Good morning, Gwen.
Hi, good morning, Sheila. Good morning, Heidi. Good morning, everyone. Good morning to you too, Tim. We're still not going to give you a hard time. I'm Gwen Sims. I'm the Deputy Director for Harris County Public Health. Director Robinson, unfortunately, is unable to join us this morning. But I do want to say, first of all, that I'm very proud and happy for Tanvir. Congratulations again, Tanvir. And on behalf of Harris County Public Health, while we look to fill the position that Tanvir has vacated, we understand the importance of the work of the Health Equity Collective. So in the interim, our agency has decided to appoint Stacy Lofton. Stacy is our senior policy planner for Health Equity at Harris County Public Health. And Stacy resides in the Office of Policy and Planning, which is led by Radhika Kuchadkar. I'm not sure if Radhika's on. Radhika's team in the Office of Planning and Innovation at Harris County Public Health is where our health equity work is housed. Stacy in the interim will serve as the background lead and representative for the Health Equity Collective on behalf of Harris County Public Health. Let me tell you a little bit about Stacy. Although modest, Stacy Lofton is a health equity and social justice strategist with over 15 years experience. She has led community and organizational efforts to operationalize health equity. Stacy has worked at every level of government and across various sectors to implement, innovate, results-driven policies and practices. At Harris County Public Health, Stacy helps to build organizational capacity as we aim to address health equity in all of our work and across the department. Stacy holds a Juris Doctorate and a master's degree in public health, and it's definitely well qualified to fill this role in the interim. And we are happy to have her represent us. And I think Stacy's on as well.
I am. Thank you, Gwen. my honor to continue serving the collective in this expanded capacity. When I was a baby public health professional back at CDC, my mentor, Dr. Leandris LaBird, advised me that equity requires a good measure of intentionality, commitment, and courage. And that intentionality is not just to kind of maintain a status quo, but to reimagine systems and structures that have created or perpetuated the inequities that we all work to address. And also, to have the courage to act and not just talk about those inequities. And so I admire how this collective has done and continues to do just that, right? The collective, I've been working with the collective since 2018, a little bit after I started at Harris County Public Health. And I admire how the collective has continuously grown and developed with intentionality and thoughtfulness. I'm also inspired by the commitment of the collective and the various members who participate on these calls and roll up their sleeves to do the hard work of pursuing equity. And so I'm just delighted to serve in the interim. So thank you.
Thank you, Stacy. We're excited to have you in this new role and to continue to work alongside you. Lots of change. We're gonna make good things happen.
Welcome. Constant.
Exactly. That's what we can count on.
And we started it on the right note of having tacos together.
Yes.
So. And we're going to continue now with celebrating some of the recent wins around the collective. Srila, I'll pass it to you.
All right, thanks, Heidi. Okay, so let's go one by one. So just want to share the work that we're doing is about building connections in the community. We want to connect the existing dots, not create more dots, and be more efficient. And to that end, there's a lot of outreach and conversations that are happening as part of the collective. And so we've had, just since our May meeting, over 100 new members in the collective, and we are over 150 organizations strong. And it shows the commitment in our region, I think, in regards to this work and the realization that partnerships and collaborations do matter. And so we're very excited for this continued momentum. And I think it is on all of us to see how we can build on this momentum and push some of the work forward. And to that end, we'll next just want to give a huge shout out to our frameworks and metrics work group led by Michael Walsh from MD Anderson and Nadia Siddiqui from Texas Health Institute for having finalized our framework for the work of the collective to achieve better health together. And we'll learn a little bit more about that in their presentation shortly, but it's a huge achievement because this is built all by consensus, getting feedback from the collective membership and the work group, and for Michael and Nadia to lead those conversations and bring us to this point where we can next start thinking about the metrics underlying the framework. So it's very exciting work, lots of months of and hours of working on this. We also, as we had announced in the May meeting, we have at that point, we were initiating the work. Well, we are now squarely into the work of building the resource directory exchange led by PCIC, Valnity, and Combined Arms. And I know we have some updates coming today on that end, but that work is squarely underway, and we have a handful of key MVCs, I'm going to call them MVPs, most valuable players who are participating. These are organizations that are participating in the resource directory exchange. So we'll talk about that in just a minute. And to that end, next bullet point, I think, is, the work of technology really needs to be led through governance. And so Aja and David Goodman at Aja has really been leading the data governance conversations and the process for the CIE that includes the resource directory exchange. So we are starting with that. And so we'll learn about that in just a few minutes as well, but that work is also squarely underway. And then we've launched the mental health and substance use work group. This is a new work group. And we are very excited. The work group is very robust. And we are very excited to get this work moving. COVID has further highlighted what the challenges around these issues. And so we are excited to help connect the work around this. And then next, I think it's the next slide. Oh, no, sorry, it's not. But, and then you will hear in a few minutes about the website development, which is now complete, and soft launch is underway. Incredibly, I don't even know how many hours of work that our communications work group has put on this. Alicia, Melissa, for leading this work, but just really excited to see the website now complete, and the soft launch is underway, but everybody will get to see it in just a few minutes. And then last but not least, I think it's the next slide. We have our first peer-reviewed publication. Of course, this would not have happened without the contribution of our members, and it's accepted at Health Equity, and will be published very shortly. We'll share the paper, but it really frames our work. This was before we even had a name, as everybody knows, submitting something and to get accepted and published takes a while. And we submitted this when we didn't really even have an official name. We had the long one, Greater Houston Coalition on Social Determinants of Health. But we're very excited that we've reached a point now where we can share broadly about our work. And a huge shout out to Dr. Jemima John, who is a postdoc working at UT Health, working with us on the collective to lead this manuscript. All right, I'm passing it back to you, Heidi.
Yes, thank you. So as we move along into the work, part of our goals for this year, we're really thinking through the sustainability plans for the collective and the role and the value add here, and how it's different. The systems approach is quite distinct and should be designed to support all the different organizations. And I think this is this delineation is really important as we build out some of the strategic plans for the collective moving forward. We're looking at building out the impact strategy. So that mental health work group launch is a part of it, but also for some of the things that have really been underway, we've really focused on what are the systems needed to improve care coordination and address social determinants of health, and really taken already a very deep dive on food security. We'll be looking at the progress in both of those areas here just shortly, but at the high level wanted to, really look at the collective and what are those opportunities for us to really strengthen and learn and then support policy change that continues to grow the work that we're doing and improve health equity alongside so many of you and your member organizations that are working at the grassroots level, often very much within communities or specific neighborhoods, and beginning to build that connection and alignment, again, anchored by the framework that we're going to hear about here shortly. You can really see the path forward of how it's all coming together. And we're working with the steering committee, just beginning some of those strategic planning processes, and we'll be coming back to you all for input and guidance in shaping out some of those plans and shared efforts in the new year. So more to come on that. And just to kind of a glimpse here of what we've begun to think through, again, that improved social determinants of health, or excuse me, social determinants of health care, improving food security, and improving mental health. So those impact strategies, you can see we're building in the community voice to inform that alongside our many organization partners. And this is the part where we'll be focusing in. What are those shared strategies? How do we align the many efforts that are happening across neighborhoods, within neighborhoods, and across the region to understand where the gaps, the overlaps are, and how we can be stronger and more impactful together. So then looking to improve that care coordination across these impact pieces, and then improve access and services to really improve the actual health outcomes. So that's kind of the journey that we're embarking upon, continuing and building on the work together.
Heidi, I just wanted to say, sorry, can I just say one thing?
Yes, please do.
I think just to, for those of, if there's any new folks in the audience, just to say that, reiterate, I suppose, is that, we're not, the collective is about connecting the work that's already out there, bringing the best practices. The collective is not looking to be another service agency. It's more about facilitating and optimizing and scaling the services and best practices that are already out there. And we have a lot going on in our region, which is great. It's about how can we help facilitate that work even further.
Excellent. Yes, very much so. Yes. And we're not alone in doing this type of work around the country. And so a few updates for those of you who might not be tracking things. There's so much that's happening as we build this system here in Houston. There's so much that's happening on the national level to provide guidance in a way. And so the first piece there is Civitas, and Civitas is a new merger between the National Association of Health Information Exchanges, so the patient data, and then also networks for healthcare improvement, similar to this collective around the country. We had the privilege of presenting the work we're doing here in Houston back in August with them. And lots of opportunity to kind of learn together and not reinvent the wheel there. And then NASDO, the National Association for Social Determinants of Health, they're doing so much on the policy level. There's so many policies right now at the federal level. And they're very interested in tracking the work that we're doing here in Houston, which is exciting. Also, for those of you who may not have seen, Congress launched a caucus for social determinants of health, which is really exciting and kind of reflected in the number of policy opportunities that are happening at the national level. They called for input. We provided input kind of through Civitas and NASDO. And they continue to call for that. So for those of you who have policy people, that's an exciting thing to be keeping tabs on. And then the Gravity Project, I talked a little bit about them in our May meeting, but really they're defining terms of what is the definition of certain social determinants of health. They've got the whole list. And those are being then turned into ICD-10 codes. They had in kind of the data standards. So you can see some of the points here of the HL7 fire standards for clinic and their clinical implementation guides. and also beginning to pull together resources on social needs and kind of the evidence of how do you address the social needs. So a lot of progress in some of the tools and resources that a couple of years ago just didn't exist. As we build out our metrics and our tools, it's important to kind of keep that alignment of what else is happening around the country. Did you want to chime in here, Sheila?
Yeah, I just want to say that as we build out, as Heidi just mentioned, I think you brought it together nicely, Heidi, that, you know, we want to bring these learnings to, and the work that's happening through our frameworks and metrics work group to next build out these metrics and have those available. Everything will be available to everybody freely for use as they need.
Thank you. All right, let's move along. We've got a lot here. And I have the community updates here. I thought they were later in the agenda. We will pause for community updates here. And so I will open the floor to folks for any community updates of events coming up, things the collective should know, important additional milestones. I've just shared some of the things from the national level. I know we've got things happening here in Texas and in our region. Please feel free to come off the mic or come on camera and share, or you can also type it in the chat, either way.
This is Srila. I'll kick it off by sharing a couple of updates from UT Health. UT Health was, the School of Biomedical Informatics and School of Public Health was awarded the Get Fit grant, which is primarily to build the public health informatics workforce and training in our community across the state of Texas, and working with primarily minority serving institutions in doing that. This will be a statewide effort, including in Houston, over the next, I believe it's 5 years. And then the Texas Epidemic Public Health Institute, which was funded through the state legislature, and UT Health will serve as the anchor for TEFI. That's primarily going to focus on pandemic preparedness and improving and increasing the workforce around pandemic preparedness and training. So that will also be initiated, I think, soon, but by next year. Yeah.
That's exciting. Maggie, I saw you come off mute too.
Yes, I wanted to share about my organization's summit. So I work with It's Time Texas, and we're having our 3-day conference called the Healthier Texas Summit. It's in partnership with the University of Texas Systems. It's from October 27th through the 29th. We'll have a lot of really cool sessions and keynote speakers and networking sessions. And something exciting is it is free for nonprofits and government agencies. So I'll put a link to the website in the chat box, and you guys can check it out. I think our agenda is currently live now, so you can see what sessions are going on. But thank you.
And Heidi actually will be speaking at the session representing the collective. Heidi, if you want to put maybe your session in the chat for folks to attend, that would be great.
Yes. Well, and I'll also post it on Mighty Networks.
Good morning. This is Sheena Lemon with TMF Health Quality Institute. We are a quality improvement organization contracted directly by CMS to impact the quality of care for Medicare beneficiaries. Yesterday, I actually posted an upcoming Community Coalitions event that we're hosting that will be centered around COVID and opioids misuse. And Dr. Michael Sprintz, who is the CEO and founder of Sprint Center for Dr. Payne, who is also a recovering addict himself. He, after 21 years, he'll be actually our speaker. We'll actually have social determinants of health data as well. It is a risk analysis, is a predictive risk analysis for the Houston area. So we're excited. I'll go ahead and put the link to that registration of that event. It is on October 27th from noon to 1, so during lunchtime. So I'll go ahead and put that. Thank you so much.
Thank you, Sheena. Other community announcements?
Hi, Heidi. This is Kara Baez. Do you hear me okay?
Yes, I can. Hi, Kara.
Hi. Hi. So this is Kara Baez from Baker Ripley. I just wanted, it's an adjacent kind of shout out for the community, but we'll be hosting a joint press conference today with Harris County Judge Hidalgo on the child tax credit. So with the support of the county, we will be at Baker Ripley, we'll be extending hours and capacity for low income tax prep support throughout the county. So as many of you know,
Uh-oh, did we lose her? Kara, we can't hear you anymore. Perhaps you can put the details in the chat. That sounds super exciting.
yes, sorry about that. I'll put the details in the chat. Thank you.
Thank you. Thank you for sharing. Others, any other community announcements? All right, I'm going to go ahead and move us along in the interest of time. If y'all have other things, please do feel free to put them in the chat. And we are going to move on to the community updates, or excuse me, the work group updates, and talk a little bit more about all the work that's been underway. So just for those of you who might be new, a quick overview of the work groups. We've got the 8 work groups here. The co-chairs of those work groups serve on the steering committee alongside the backbone leads. And we've got a group of executive advisors supporting this work as well. And we are going to start it off with frameworks and metrics. Nadia and Michael, y'all are up.
Good morning, Heidi. Thank you so much for the opportunity to talk with everyone today. Nadia and I are privileged to share this work on behalf of the highly engaged and really selfless work group for the Social Drivers of Health framework and shared measures. Our work group really began its journey about 2 years ago, and we engaged, I would say, discernibly and really in earnest in March of 2020. And so I think across our entire community and all the folks that are on the call today, we all know that we do really good work and work that's really meaningful. And so it's a question of really how do we best focus it? How do we use data-driven approaches to drive prioritization around this work and drive action together where possible? And ultimately make disciplined choices based in shared values with partners and with our communities as well. And so I've always believed that partnership is really the most basic and fundamental expression of hope and optimism, that something better and more impactful is both possible and must be pursued. So this work and frameworks really is that a demonstration of that value for all of us as a work group and for this entire collective. And so as you look at it together, really, what is our expression as an entire collective of hope? And really through its partnership and what we can do together by looking at this nexus of equity and the greater Houston community in a manner that is equally focused on new questions, applied sense of urgency, and really effectively deploying what we already know works in our community to really drive impact with high degrees of velocity for greater Houston. Next slide, please. So in 2021, one back, thank you. In 2021, really the focus of our work has been threefold. And really first, we wanted to make sure that we could work in a highly collaborative and consensus-driven manner to finalize the Health Equity Collective's framework for achieving better health together. Some of you may recall, have been part of this work for some time, that we actually had a draft framework around August of 2020. And so really we took the subsequent year to really deeply dive into what we mean by what we say and how to assure that the guide for our work really achieved a couple of things we'll get to in a slide or so. We also, as a work group, want to make sure that we are very intentional in curating select language, the words that we use, what those words mean, and how we can assure there's consensus around what we mean by what we say. We also, as you heard before, are working on activating the framework in terms of common measures and common ways which we can assure that we are guiding our work and determining how we are doing with respect to our intentions. And then finally, we want to assure that this framework and this work as an overall work group could directly inform and shape how public funding and also private capital should and can be deployed in our communities to address social drivers of health and barriers to good health generally. Next slide, please. So this is an alphabetized list of all leaders who have deeply engaged in this work, and we share it with incredible pride, also incredible gratitude. This work group has met monthly for 20 months or more. We've held several multi-hour brainstorming sessions together as a work group, and also collaborated offline and over email and other document mediums to contribute, to edit, to educate, and to inform each other on what is the best way to go forward. So when we share the graphic momentarily, it really represents not just a lovely picture, but also one that is really based in true partnership, based in really the true aligned consensus action of these leaders in this list, as well as many, many more. And so we're really grateful to both the work group here, as well as all those on the broader steering committee and the executive committee who have really reviewed this framework in earnest and provided great feedback over the past year or more. Next slide, please. So really the purpose of the framework is really to really reflect and inform and support really what we hope to be the shared work of 150 plus organizations represented in the overall collective. It's meant to be an overall guide for us. It's meant to assure that we can mobilize action on multiple levels and that we are greater than the sum of our parts. That we can assure that lived experience is at the epicenter of what we're looking at in terms of assuring the choices made and decisions made with communities about what happens in those communities. That we can assure that this becomes a real thing in terms of how it guides investment, how it guides shared action. And we can monitor it in a very specific and accountable way. It's also meant to be very dynamic. We want it to be a mirror to assess the work of the collective and also a guide for our body of work. You know, as the assets of the overall collective exist, as they evolve, as opportunities evolve, as needs change, this work must also change as well. And so the primary utility of the framework is to really focus this collective action in Greater Houston and really assure we have a benchmark to inform and support this shared work together as leaders, as organizations, as community residents that all have interests in health equity for Greater Houston. I think it's really important that all stakeholders see themselves in their work in their specific individual or organizational context in the framework as well. The framework informs the overall evaluation of the broader collective. In many ways, this had to come first. We had to ensure we had an overall idea of how we would act together to then inform what we would do together. And again, as I mentioned before, we have common terms that are highly selected, that are positively oriented to assure we can reference and be very clear about what we mean as we talk about how we would move together toward actions in achieving better health together in Greater Houston. Next slide, please, Heidi. So as mentioned, the framework is the product of more than a year and a half of intensive work of investment, extensive literature review, assessment of health equity and social drivers of health impact models that are being deployed across the United States, and also represents really the focused direction of really what is the 150 plus organization members that are part of this health equity collective. The health equity collective framework provides really two-part framing. The lower half, referred to as the drivers for health, depicts the upstream, midstream, and downstream factors critical for providing all people with fair and just opportunities to achieve their best health. And with respect to the drivers of health, the framework ultimately reflects the adaptation and expansion upon the Bay Area Regional Health Inequities Initiative, or BARHI framework, for reducing health inequities in that region of the United States. We also adapt that substantially for Greater Houston, as you probably can appreciate. The top half is referred to as really the actions for health, represents the tangible work of this collective, as well as the unique contributions of the membership of the collective toward the advancement of health equity objectives in Greater Houston. The framing of community at the epicenter of the top half of the framework, as well as the color scheming from the kind of the greenish yellow from the community engagement down to living conditions and the societal values and context, policies, and as well as behaviors and outcomes is highly intentional. It's meant to assure that the diverse individuals, families, stakeholders, leaders, organizations are working collaboratively together to advance the health actions, which we believe will make a difference in our broader community, and that voice in the decisions, in the actions, and how we would define deployment of capital, how we define employment of actions, is directly informed by lived experience in our greater Houston community. I'll pause here for folks to look at the framework for a few minutes to make sure we can get a good sense of it. And Nadia, I welcome your handoff at this time for further discussion of the framework as well as next part of the presentation.
Thank you, Michael. Good morning, everyone. That was just beautifully laid out. I'll kind of transition us to the second part of the presentation, but we'll spend just a couple of more minutes here. I think there are a few things to reiterate that Michael mentioned. The framework may look familiar to you because we have built it upon the Barhigh models, the Bay Area Regional Health Inequities Initiative that has been around for many, many years and has served as a tool and resource to so many of us across the country. So we actually started and landed through a consensus-based process with that framework. And as we started to adapt and tailor the framework for our collective, what became really apparent and important was the need for us to flip it to a positive aspirational framework, to move us very intentionally. And I'll use Stacy's term, intentionality is so critical when we're taking on the work of equity. And so very intentionally moving this from a frame of, continuing to highlight inequities, disparities, and deficits to what is it going to take us aspirationally as we come together as partners in this community to move the needle on health equity. And so you'll see that flip taking place, and all of that honestly took place, a lot of the intentionality between August and launch till today. So very excited and about that switch framing as well. And then I think the other thing that's critical to recognize is very often we get tied in kind of the midstream social determinants of health, and we think that we're done. That's where the work needs to happen to move the needle on health equity. But the reality is we've got to push ourselves farther upstream to address the root causes of health inequities in our communities. And that really starts with addressing suicidal values that shape narratives. So how we value individuals, communities, people of color, people of different backgrounds dictates the kinds of policies that get put into place that then drive the social determinants, level opportunities, and then further downstream outcomes. So it's very important for us to be very intentional in ensuring that this framework and the work that we take on as a collective really spans the full spectrum of upstream, midstream, and downstream efforts. And so the next step for us from here was, and what we continue to work on as a work group, is adding precision to our language. Next slide, Heidi. And so one of the very first terms that we've started with is health equity. We're the Health Equity Collective. And so we need to really arrive at a shared definition, concept, and understanding of what health equity means to each of us, but importantly, when we come together as a collective to drive action. And so we started down this path several months ago as well, in particular with the MD Anderson team, who took on the effort of conducting a systematic review of health equity definitions and a literature review, dating back many, many years, decades. This work has really been going on for quite some time. So taking a critical look at these different definitions to identify and consider, what really is the one that would align with the work of the collective, both the framework, but also be a definition that's consensus-based and endorsed at all levels of this collective, from our work group to the steering committee to the coalition at large. So we'll share with you momentarily what we are proposing as a work group, as co-chairs, and as steering committee for adoption. Now, in selecting the definition, as you'll see, alignment with the framework was an important endorsement at all levels, but additional criteria also was kind of built upon from Dr. Paula Braveman's work. She's done decades of work that builds on Margaret Whitehead's work and the World Health Organization as well. And what she identified in her work as critical to defining health equity is a true commitment to fairness and justice, the need for a definition to be unambiguous and actionable. It must be consistent with scientific knowledge. So we're not just coming up with a definition, but it's truly true to the intent, that it's inclusive and respectful, that it resonates with broad audiences. And this one is important for the collective. So having the opportunity to ensure that this definition really reflects the many different parts of the larger collective. And recognizing that equity is both a process and an outcome. Very often we work toward realizing the vision of health equity at the end, but we fail to recognize that it requires building equitable processes to get to that equitable outcome. And that's going to be very important, as you can see in the framework, to the work we do. And the final and very important is that the definition be measurable so that we as a collective and as partners can hold ourselves accountable to this journey. Next slide. So after having weighed several definitions, like I said, a large body of literature that we considered, definitions from CDC, Healthy People, World Health Organization, where we landed as a work group and as a steering committee and as co-chairs together and really reached consensus was around Dr. Paula Braveman's 2017, her most recent definition of health equity, which is based in justice, is actionable, and is measurable. And there are a few different versions of even the definition that she has built. There's the 8-second one that you see in green. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. But we're recommending the adoption of the broader definition that includes these next 2 lines as well. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. And the third component, which is the measurable piece of it, for the purposes of measurement, health equity means reducing and ultimately eliminating disparities in health and its determinants that adversely affect excluded or marginalized groups. So, just want to point out a few things from the criteria in terms of this is truly a definition grounded in the concept of fairness and justice. It views equity as both a process and an outcome. It also necessitates that we as a collective really move very far upstream to address poverty, discrimination, their consequences, and the root causes. And it's got that measurement component built into it as well. So in terms of next steps, Heidi, I'll ask you to move to the next slide, please. So in terms of next steps, this is where collective, we'd like to hear from you. So much like the survey that was sent out, a quick kind of 2-question, 2-minute survey, we will be circulating following this meeting a brief survey to seek your endorsement for the adoption of Dr. Paula Braveman's definition of health equity for the Health Equity Collective. So again, a very quick survey, and we look forward to everyone's participation in that survey. I want to also highlight kind of an additional next step. So in collaboration with other work groups, we will also continue to finalize a subset of definitions for key terms that align with the framework. So what do we mean when we say a driver for health or an action for health? What do we mean by the 4 actions that you saw up above? Importantly, what do we mean by community engagement? And how do we operationalize that? And Sean Haley and Veronica and their group are heading a lot of that work as well, and you'll have the opportunity to hear more. So we'll continue to work with the work groups to really bring intentionality and precision to some of these terms and concepts so that we can begin to then fold them into our metrics and really then inform the accountability piece of our work as well. So I'll pause there. I think that may be the last slide. Michael, if you have anything else to add, and then we can turn it back.
Thank you both for your leadership in this remarkable accomplishment of really guiding the work across our region. And I know that already beyond our region, people are seeing value in this framework and development to help guide health equity and social determinants of health work. So thank you both for your leadership. Really, really excited about the next steps of putting this to work. And with that, we are going to go ahead and move on to our communications, calling up Alicia Johnston with Humana and Melissa Danaho with UT Health, co-chairs for communications. And we're going to talk about more accomplishments there.
Hi, good morning, everyone. Alicia Johnston here. I'm not going to spend a lot of time at the top here with the brand and digital presence, at least the first few bullet points, because we did touch on that in our May meeting. The vendor embedding process, this is something that we have revisited. We are nearing the end of our contract with Versa Creative, who has helped us with the logo, with our tagline, and the whole rebranding process. They're also helping us with the website, but we're exploring other options now that work is coming to an end. So currently, we're working on the website. As mentioned before, there's been a lot of hours, spent on this, but I really couldn't think of a better group of people, a more passionate group of people to spend that time with. And so very grateful for everyone, Melissa, Wes, and everyone in the communications work group, as well as our backbone leads. So we're preparing for a soft launch of the website. We do not have an exact date at this time. We do anticipate that it'll be in the next few weeks, and so we will be sharing a link with everyone. We're also working on our social media presence, and Melissa Dano has already set up those accounts, and we're just loading pictures and content and so forth, and we'll be launching those soon as well. So Heidi, if you want to switch over to the website, we can just give you all a glimpse of what it looks like. We do have a test link, and we've been doing the quality assurance testing and so forth. So let's see. So we're just going to show you a few pages here. This is our landing page, opening with the tagline. We had a challenging time looking for images that really capture what we do. So we have put kind of a pause on that, and we're going to actually do a photo shoot once it's safe for everyone to gather, and so you'll be seeing some updates in phase 2 of the website build. So on the landing page here, we really just wanted to highlight who we are, where we are, and the number of organizations who are part of the work. And then of course the footer that you see here, this is same throughout. We really want to, again, drive folks to the framework, because that is, the centerpiece of our work, as well as, pushing people towards how to get involved. So Heidi, if you want to go to the framework page. So you all saw this just a moment ago. Nadia and Michael did an excellent job reviewing, this work, and just really grateful for their leadership here. So this framework page, if you scroll down, you'll see, you can view that list of contributors that was on the slide just a few moments ago, as well as that detailed description of the framework and how it was built, the number of hours put in, and then the definitions will be added as a part of phase 2. And now if you'll go over to the resources page. And so what we're trying to do here, many of you are already a part of Mighty Networks. I added the link to the chat a few moments ago. I'll add it again in just a few minutes. But what we really want to do is to figure out how to merge these two, at least until we get our full tech stack developed. We're looking at Salesforce and other, other options to really serve as that CRM and assist us with communications and marketing. But for right now, we're going to be using the website and Mighty Networks really hand in hand. So you'll see a lot of links pointing you back to Mighty Networks, particularly around the events page. And then a lot of the content here is also found on Mighty Networks, but we just wanted to call out our specific work as well as the work of the work groups. So you'll see our progress reports, the work of the Coalition Alignment Work Group, as well as the Data Sharing Ecosystem Work Group. So you'll get a link to this in just a few weeks. And again, thank you for everyone who has assisted in this process. It's just been such a joy to work with all of you. So with that, I'm going to pass it over to Melissa to talk about our goal 2.
Melissa, you're on mute if you're talking.
All right, so I can cover this one as well. So we've also been working on initial marketing plan. Back, I guess it was earlier this year, we began working with each of the individual work groups, really just gathering feedback, what we had initially planned in March of 2020 when we launched the work groups, the in-person meeting, the networking sessions. All of this, was tabled because of COVID. And so, we wanted to make sure folks continue to stay connected. So we launched the work groups. Wes has been leading that work and just doing a tremendous job. Really grateful for his leadership there. We've also been maintaining a resource hub on Mighty Networks. So every time there is a networking session, we're gathering resources from the community so folks are more aware of the work that's being done and they can get plugged in. The Coalition Alignment Work Group is stepping in and helping with that as well. And so we're trying to figure out how to take that to the next level. And we just recently launched the new member orientation sessions as well. Heidi and Melissa have been leading that work. And then we're, of course, generating a list of, content for development, in the coming months and the year ahead. So you'll see in one of the last slides, I believe, Heidi, you'll see the dates and times of both the networking sessions as well as the orientation sessions. So if you're not already plugged into those, I definitely encourage you to do so. Thank you. That's it.
Thank you, Alicia. Great progress. It's really exciting to see the website coming together. And now we're going to shift to the data sharing ecosystem work group. Eric Bakota, can you kick this off for us? Oops. He may have been pulled into something. Let's go ahead and move to Kalal. Kalal, can you take it away and talk a little bit about the work that you and team are leading in developing the resource directory exchange?
Sure. So I'll buzz through a few slides here quite quickly. I think in alignment with a collaborative approach of this collective, the work that we're doing is bringing 3 technology solutions providers together in our Greater Houston area, and really looking at what it means to connect up these 3 systems. So PCIC, Wellnity, and Combined Arms have already started working together. Our focuses are in very different areas. There is some overlap, but you'll see that key work areas for each of these 3 different agencies are slightly different. And so what we've looked at is what does it take to connect behind the scenes infrastructure of these 3 separate work areas. Next slide, please, Heidi. Our focus in the phase 1, initial phase, is really to look at what does it mean to connect resources across different resource directories in a federated approach. And what does the power of a combined resource directory look like? And so that's bringing together 3,700 different resources from PCIC, 2,500 from Wellnity, and about 550 from Combined Arms, and having an environment that's accessible and available to all members of the Health Equity Collective, as well as the public in Houston. Next slide, please. And I'll just buzz through this to give you an idea of how we're building this. The idea is to really build it in a modular approach so that the focus is looking at what kind of APIs or application programmer interfaces can be pushed out so that this framework that we build can be expanded out to other solutions or other agencies that may already have their own systems to tap into. A lot of that initial work is around just standardizing of data structures. I think earlier in the slides we saw about work from Gravity Project, work from a bunch of other national efforts around this exact area of how do you standardize. And so our focus is going to be on two specific standards around an open referral standard is one, and around the AIR standards that's been available for quite a long time for any kind of INR work. And to look at how we can translate between these two standards and how we can have an ecosystem where resource information can be shared across different directories and can be viewed. So end users can view resources across different directories. The piece in orange that you see is where a large portion of our effort is going to go into in this phase is what does an open API engine look like for the community, so that you can make cross-directory searches, so that you can make update recommendations towards a directory. And we can actually build in a feedback loop into the system so that things like accuracy, performance, and effectiveness of resources can be monitored and tracked within the platform. We're going to look at the green part that you see on top is really two entry points into the architecture that we build out, which the focus is going to be on API access. And then there is also going to be a UI component or user interface component to it as well. So this is boiling down quite a bit of work into one overviews of what our phase one work is going to be. Next slide, please, Heidi. To give you a visual look at what this means, at the end of 6 months, what we hope to achieve is, if you click next slide, is a connectivity between these three systems, and then a connectivity to a broader network, which is we're also going to be looking at tapping into 211's United Way 211's resources that's hosted there, and to see how that can be pulled into an ecosystem. And this is where the translation of two different standards is going to be looked at. Our hope is to get to a point where there may be coalitions that are hosting their own set of resources or resource lists, and how can we build an ecosystem where that information can also exist or coexist with a broader directory. And so designing components into the infrastructure to support this scaling in the next level that we hope to take on. And then my last slide is really the key deliverables at the end of 6 months that we will be working towards. There's 4 main areas. It's really doing a detailed landscape analysis of directories that's available in the community, both structured and unstructured. Second is the standardization. That's going to be a big focus for us. The third part is the development of an API engine that's will be available for the entire community. And then the fourth is really having a proof of concept of a federated model of connection, which till now there really isn't there isn't a model like this available in the country. We will be one of the first to build this up. So this is quite exciting work for our collective. And I think that was the main thing that I wanted to cover in today's talk with respect to the data work group.
Thank you, Kalal. Really appreciate your leadership and partnership in building this resource for our community. And guiding this work, do you want to chime in, Shrila?
Yeah, I just want to say thank you to Kalal and group. I just want to say that the intent is to build this in this proof of concept, but then in the next phase to scale it as well. So we're building it with the intent of ultimately scaling it. And so a lot of the data governance conversations that are happening right now will inform that, but just wanted to put that out there as well.
Exactly. Thank you. So we're going to move to data governance, and really this is the beginning of the framework of starting with a small group and growing from there across the collective in the region. I'm going to pass it to Autumn Felty, who is helping to lead this work for Aja. Autumn, you're up.
Great, thank you. And thank you, Kalal. That was really great. So David wasn't able to be here this morning, so I'm going to talk through this just pretty quickly and happy to answer any questions folks might have. So I'm with Aja Data Consulting. We are out of Montreal, Canada, and also Katy, Texas. And we are, as Heidi and Srila said, we are here to develop a governance layer that will kind of be a foundation for the technical work that Kalal and team are doing. And it'll also ensure that the key stakeholders that are involved in this work, who will kind of go have a peek at in a second, that their constraints around data, their preferences, their needs are all kind of built into the system for long-term sustainability. And the governance structure that we work with, it allows for future expansion. So we start small with a handful of organizations, and then the idea is that additional organizations can pretty easily kind of join this governance structure. Their needs can be met within the system, so that it can grow and become like a really vibrant, community-driven experience and piece of technology that can really help you all in the work you do. So next slide, please. So this is just a little bit about what we do and how we work around data collaborations and data governance. So our work is kind of built out into 3 phases. What we are doing right now is working with the MVC organizations, which are the minimum viable coalition is what we call it, to understand their unique needs, like I mentioned before, and then also develop this kind of collaborative decision-making structure, which is formalized in a data collaboration charter. It's kind of the rules of engagement that we all agree that we are going to follow as we work together through this and make decisions about the data that we are agreeing to combine. Part of that work initially is to go through a set of collaboration activities. So understanding what the goals and the challenges are for this work, understanding the relevant data and technical aspects of the work, and then the governance specifications. So your decision-making process with organization 1 might be slightly different than how organization 2 works. And we need to understand all of that so that we can work it into a governance structure that really works for everyone. And then thus we can build out this governance structure. Next slide, please. So this is the MVC list of organizations. So the Health Equity Collective obviously is the lead organization. The ones listed under MVC members, those are the group of organizations that Heidi and Srila and their team identified as those that are initially necessary to fulfill the initial focus of the data collaboration. So they each bring kind of a unique perspective to this work. They are end users of the technical solution that Kalal is building, and they also have specific needs around referrals, which is kind of the next phase. And so it's really important that we are able to meet with all of these organizations initially, build their unique perspectives, data specifications and things into the understanding of how the data will work. And then ultimately, when there's a technical solution in place, then those are built in a more streamlined kind of behind the scenes way. And then we're working very closely with PCIC, Wellnity, and the Combined Arms kind of collective team to understand the work they are doing and support them in gathering the requirements that they need to build this infrastructure, and also do so in a way that adds unique value to each of these organizations. So a big part of what we're doing in the initial meetings that we're having with each of these MVC members is trying to define a value statement for each of them. How is this going to enhance the work that you do, make it a little bit easier, relieve some of the burden on the service providers, those you work with? So that's really top of mind, particularly starting out as we dive into this work. Next question, or next slide, sorry. All right, so I mentioned before that we are in the phase 1, the design phase, which is what we call it. So we're having these, we have convened the MVC, we did it a little bit differently and did a recording, and now we are having one-on-one meetings with each of the MVC members to understand, like I said, their value statements around the resource directory. And then in the next set of one-on-one meetings, we'll start talking with them about referrals, how their current referral processes work, what they can and can't share whenever they're making referrals for clients to different organizations and things like that. We're gathering their data specs, their preferences. We are going to build it all into a blueprint for a governance framework that we will launch in phase 2, or that we will formalize in phase 2 and then ultimately launch in phase 3. So that's kind of the stream of work that we are focused on. And if anybody has questions, I'm happy to answer them. I think that was my last slide.
Thank you so much, Autumn. Yes, if there are questions, I will just also underscore, like, this is the process for the resource directory exchange. And this will help to inform the development of the care coordination, which Aja will also be leading the governance for that component of the community information exchange.
Thank you.
Thank you so much. All right, I'm going to move us along. If you have any questions, please do feel free to come off mute and ask them, or put them in the chat as we move along. Lots of good progress. It's exciting to see it come together. Here's Aja's contact information for anyone who would like to reach out to them. And then I'm going to pass it to you, Stacy, and Tim for a policy update.
Sure. Tim, did you want to start with what we've accomplished thus far, and I can talk about where we're going moving forward?
Sure, we can do that really quick. And obviously, we have a lot of work that's gone on over the last 2 years. We were directed to jump in and kind of monitor what's going on with policy and of course policy in this world. As it relates to legislation, at one point I was tracking all the bills that the Texas legislature was dealing with, and my tracking list got well over 1,000 bills pretty quick. And you really aren't tracking anything if you have 1,000 bills on a tracking list. But there's so many areas and so many things that we could be talking about. And of course, the focus on food insecurity, and then moving upstream. The committee has talked a lot about everything from housing, transportation, all sorts of things. But we've spent a lot of times focusing directly on the policy recommendations related to WIC and SNAP and the National School Lunch Program. I think we've distributed those to everybody in the past, so I won't go over each one of those recommendations. But we need to kind of continue to work with our food banks and our Feeding Texas organizations, local and national organizations, to get some of those policy recommendations going. And then during the COVID recovery process, or I guess we still are in the COVID recovery process, we made several recommendations that have been distributed as well through the committee related to investment in unemployment insurance, which the legislature has done. Actually just happened this past week. And that we take a look at racial equity and local resilience of food systems within the COVID-related bills that are happening. And there was quite a bit of work at the federal level that met those recommendations. And then we had some ideas about continuing the pandemic EBT food process and expanding SNAP. We did make a few incremental step of progress with the legislature this session. And I say we, only because a lot of us are members of statewide organizations and work with and advocate collectively with others. As the health equity is fairly young, we haven't really built a full-on policy and advocacy machine yet. We're really more of a distribution of information and ideas and spreading stuff. So we got that out, but the SNAP program, particularly for seniors, made some progress this session. So that's kind of a quick kind of overview of where we're at. Stacy, go ahead and take it from on what we'll be doing over the coming weeks and months here into 2022.
Thanks, Tim. So we will continue to monitor proposed laws and policies and address the equity and social determinant impact of proposed legislation. This fall, we are starting to conduct a local level policy landscape analysis. We want to examine essentially the confluence of food insecurity, economic and housing insecurity, as well as transportation equity in our region. And to that end, during our October meeting, we invited Link Houston to talk about their work on improving transportation options and developing transportation policies and practices for communities, particularly those communities that are also experiencing food insecurity. We also intend on, after we complete the landscape analysis, drafting additional local level policy recommendations for 2022. And we want to ensure that equity-centered policy change is embedded across the work of the collective as a cross-cutting activity. So really being engaged in all of the work groups and contributing to those work groups, especially as it pertains to the potential of developing or addressing existing policy, developing new policies or addressing existing policies. And then we also want to build and strengthen grassroots advocacy on behalf of the collective. So that's moving forward to 2022. Thank you.
Sorry, I lost my mute button. All right, let's move along to community voice. Veronica and Sean, y'all are up.
Good morning, everyone. This is Veronica. How about the Stros for the win last night? Just thought I'd send a little shout out to the home team. We're very excited at Community Voice. We've had some great updates for you all. As you all know, Community Voice is going to be a big part of the collective, being able to share internally as well as externally what the collective is doing, our goal, our mission here in the area. So updates for you all. We have been working on 3 definitions. What is community voice, defining exactly what is community voice, and community engagement. So we have been meeting with our work group as well as some subgroups through multiple iterations to develop and refine those definitions that align with the collective's language as well. So we've also presented these definitions with the frameworks group with Nadia and Michael and their team. So we're hoping to get that vetted and make sure that the language is correct and useful for our collective. Next steps, we'll be getting those edits from the frameworks, as I mentioned. We also want to develop a model on how can we get input from the community on these definitions, that they are definitions that the community can understand and are able to communicate back with us, and there's transparency involved with these definitions. So that would be our next goal. We're creating some subgroups as well to help with that. And then we hope to have those final definitions available to you all to also get input from you all. As we all know, in our current jobs, we already have some of this language, we have best practices, and we are more than happy to get that feedback from you all. And also get that support from the backbone leaders to make sure that, again, it aligns with the collective and those strategies. Sean, anything else that you want to add?
Yeah, I'll quickly highlight on the next steps, those last 2 bullets there. In terms of that, we're really excited about those 2 bullets to the drafting of a robust matrix. Essentially, we just briskly introduced at our previous meeting, this particular matrix is going to play a large role in how we move forward. And essentially, what we'll be doing is working with the Community Voice work group on a matrix of community engagement strategies for increasing the levels of community engagement. And what that's going to do, when you looked at that framework that Nadia and Michael presented and Alicia talked about as well, you'll really see how we need to amp up the community engagement. It's all over the framework, and it really sits at the pinnacle of the work. And so this matrix will help us ensure the different ways that we are supporting decision-making and action, and the actions for health and the drivers of health. And basically what we'll be looking at is really, and by the way, as we heard from Autumn, when she talked about the CIE MVCs, you saw community voice representation there as well. And so this is just a mechanism that'll be worked on here very soon. That's really exciting, really looking at the true hardcore ways that we're engaging people, from levels of informing. Are we just consulting? Are we involving? Are we collaborating? Do we have people co-leading and really anchoring that? So that's what that matrix piece is about. And then the backbone leads are working really hard and diligently looking for funding to support these strategies. So we're excited about that and what's forthcoming. The only other thing I'd note real quick that we didn't have as a bullet up there is that our community voice work group will be really examining kind of the grassroots efforts of members of the Health Equity Collective to really see, you know, who's moving along with community voice and what we can learn from each other as well. So neglected to add that to this particular slide. And then with that, I think we're going to highlight real quickly so you can see those definitions. And so we can move into the next slide to do that. And I think Veronica, you want to go ahead and take us through.
Yes, so here's the first one that this is the preliminary definition here. Again, we're working on getting it vetted, but community was the first one that we tackled, which is very important. What is community? So as you can read there, take a few seconds to read it. This was very important, and what we use for this, there was two sources that we use for these definitions: the principles of community engagement and in progress and community health partnership. So we extracted some of that language from those sources to as a basis for these definitions. And then, of course, like I mentioned, we had those subgroups that we met separately on site to finalize it. And this is where we stand on community. So we want to, again, make sure that it's inclusive of everyone in the area. We can go to the next one, community voice. Again, we use those same resources. This one took us a little longer to finalize, but it turned out well. We are still working on some of that language there. As you can see, the compensates part, we welcome any feedback. We want to make sure that the question with compensates do you mean it to be a financial compensation or just more of a beneficial compensation? So this was another important definition for us. And again, it has to be used across the collective. And then lastly, we have community engagement there. So if you have any input or suggestions on any of this language, please reach out to Sean and I to see how we can perfect it even more.
Thank you so much. Exciting to see those coming together. Let's go ahead and move to coalitions alignment. Nancy.
Hello, good morning. I'm Nancy Correa, and I work with Ruth Ruckus on the Coalitions Alignment Committee. So for those that are new to the collective, over the past year, we have, our committee has spent time identifying all the coalitions that are addressing social determinants of health equity in the greater Houston area, and then surveying them to understand what social determinants of health they are addressing, their geographies, and in what way are they addressing social determinants of health. So is that by education, direct service, advocacy, et cetera. And then as we've kind of been going through a long brainstorming process on how do we really kind of support the alignment of coalitions in our region to better support kind of health and health equity, we've partnered with the leadership of the Health Equity Collective and the Communications Work Group to assist with the planning of the networking sessions. Because really, if you're trying to align coalitions, there has to be trust, there has to be partnerships, there has to be knowing each other which of course is a little extra challenging during this COVID period when we're all on Zoom. So we've been kind of over the past few months kind of working together on those networking sessions, and then kind of we're coming back together now to kind of debrief on are the networking sessions accomplishing what we're hoping to? What does the next iteration of look like that? And then as the collective as a whole moves towards the community information exchange, how can our kind of committee kind of best support that? One of the ideas that we're floating around that we'll be kind of discussing in detail at our next coalition's alignment committee meeting is, does it make sense to take the survey that we gave to coalitions around the social determinants of health and expand that to the entire Health Equity Collective membership, or are we just duplicating what United Way already has? And I don't have the final answer to that. We think it'll be helpful, but that's going to require a little bit more kind of discussion and making sure that it's really will kind of support the efforts. And then I will say, Michael Wash, during your update, and I think Ruth was texting with you, if you're going to be serving the membership, we may want to partner to try to not duplicate emails that are going out to and surveys that are being requested to the membership. So more to come there. Ruth, would you add anything to that?
Perfect representation, Nancy. Thank you so much.
And again, we are, for those in the Coalition's Alignment Committee, a doodle poll will be coming out in the next few days for our next committee meeting. Invite others to attend, because really, right, we've had, I think for this committee, the short-term goals were very, I don't want to use the word easy, but very kind of practical. And we just kind of followed a really kind of nice process, and but kind of this bigger long-term goal of actually aligning coalitions being more intellectually challenging as we kind of figure out the best strategy to do that. So certainly welcome everyone's participation and input moving forward. So
thank you both so much. Moving along to food security. Jenny and Dr. John, you're up.
Hi, good morning, everyone. So our two goals for this year are, number one, to complete our food security landscape scan, specifically the qualitative portion, and number two, to share the results with the collective and the community by the end of the year. So a few updates. In the spring, we met with members representing organizations from Bucket 1. So these are organizations that are currently screening for food insecurity. We will be presenting preliminary results with you today. This is the second iteration of the study analysis, so we're really excited to share that with you. But before we do that, I do have a few more updates related to our landscape scan. We are holding a couple of strategy sessions in the next couple of weeks. So on Tuesday, October 26th, this coming Tuesday, from 9 to 10:30 a.m., we will have a session for representatives from organizations in Bucket 2. So organizations that are currently not screening for food insecurity, but plan on screening in the next 12 months. If your organization meets those specifications, we'd love to have you be part of this discussion. Representatives and organizations will not be identified in any publications or in any reports. So if you are interested, or if you know anyone else in your team that can speak to these efforts, please let us know. You can type Bucket 2 on the chat along with the best email address to send the invitation to. And I will also be sending discussion questions in advance in case you want to look over them to prepare prior to the session. If you cannot make the Tuesday session, but you are interested in being a part of the conversation, also make a note of that on your message. And depending on volume, we can see if we can plan a different one at a later time. For Bucket 3, so these are organizations that are not screening for food insecurity and do not plan on screening. We are also having a strategy session for organizations in that group. I do want to emphasize the importance of connecting with this group. So even though you're not planning on screening, we still want to better understand how your organization is working to address food security or other efforts across social determinants of health. This can be related to advocacy, work around technology, things like that. We want to tie all of this together to help align efforts across the collective. And this work will also help us inform the workflow development for the community information exchange. So we do want to make sure that we are getting representation across organizations. A few of you have already received invitations for this session. We're planning it for the week of November 1st. So if you haven't already, please share your availability with us. I'm sending the poll on the chat. If you have not received an invitation, but you fall into this group, you can also share your availability with us using the same poll. Once again, we want to make sure we're capturing as many representatives as possible, include your voice in this piece. So if it's possible, please let us know about your interest or availability.
Thank you, Michelle.
In the next couple of days. And we can get those invitations out soon. You can also reach out to Jemmy or myself using the email addresses here if you're watching the recording later. Before I hand it off to Jemmy, anything else that Nikki, Hope, Heidi, or Jemmy would like to add about the sessions?
No, I think you were spot on, Jenny. I think if anything, it's just we've learned a lot. So if you can, please consider responding to us and helping us through this journey.
Thank you, Hope.
Thank you all. Dr. John, did you want to share your screen or did you want me to move through things?
I'll go ahead and share it.
Okay.
It says I cannot start screen share while other participants are sharing. So can I start now?
Yeah.
Okay, great. From begin, and where is a slideshow from beginning? Okay. Hi, everyone. So I am excited to share the results from our food security focus groups. Like Jenny said, this was a momentous year for the food security work group because we did meet one of our major goals this year, which was to evaluate organizations that fell within bucket 1. And so the goal of that of these efforts was to explore Greater Houston organizations' capacity to address food insecurity, targeting vulnerable populations with a specific emphasis on processes related to screening, referral, and coordination of resources. And so for bucket 1, which these were organizations who said that they were currently screening, we conducted 5 multi-sectorial focus groups of coalition members, and that was done between April and May 2021, following the 2020 Qualtrics survey that was issued out twice to assess organizations' responses to food insecurity across the Greater Houston area. So these focus groups were held virtually, and the interview guide that we used for these sessions was developed by an iterative process informed by food security work group members. And so during those sessions over the past year, we tested the questions and probes in mock sessions. And to complement that, we also had multiple training workshops for moderators and note takers involved in these work group, in these focus group sessions. Just a quick background on what we did to get a hold of the data. Focus groups were audio-visually recorded and transcribed, like Jenny said, and we took special care and effort to hide the identity of participants when we started analyzing the data, including the identification of participants, affiliation names, and so forth. We used summer interns to verify transcripts for accuracy. And so with the audio recordings from WebEx, we had the interns go in and just look at the transcripts, the transcribed reports compared to the audio-visual recordings, just to make sure everything lined up. And then on our end as a research team, we coded and we recoded, including restructuring codes where necessary, and any differences that we had amongst ourselves, we addressed it through consensus. So there are many codes that were generated from the analysis of over 200 pages of text. And they really fell into 4 main areas: organizational role and responsibility, which addressed who is involved in screening efforts, screening process. We also addressed, looked at the challenges and facilitators to screening efforts, including COVID-19 impact. And these were
these were barriers and drivers to screening efforts that came through conversations that we had with everyone involved in the focus group sessions. And lastly, from the transcripts that we analyzed, what did it say about the Health Equity Collective's ability to support CI integration and expansion efforts across the greater Houston area, as well as support organizations in their pursuit of addressing not only food insecurity, but other social determinants of health. As we can see, according to the data, we had 5 focus groups. We had 3 all-female focus groups, 1 mix, and we had towards the end a 1 fully all-male focus group. We had 22 attendees out of the 26 unique organizations who responded to the Qualtrics bucket 1. And so that's good, 84.6% response rate. We had 71% female. When we look at the racial ethnic makeup, approximately 52% were non-Hispanic white, 10% were Black, 19% Hispanic, and 19% Asian, primarily of Southeast Asian descent. And it was a multi-sectoral effort. 59% of participants were from healthcare-related fields, 27% from CBOs and community-based organizations, and 14% from education-affiliated institutions. So we're not going to talk a lot about the procedural part of screening, but just to give you a snapshot, in terms of staff utilization for screening efforts, the numbers that you see, 11 out of 22 respondents across the board reported that nurses made up most of their screening staff, followed by medical assistants and social workers. By a plural majority, the 2-item screener was the questionnaire used for screening efforts, and approximately 41%, or 9 out of the 22 organizations, said that they also screen for other SDOH, including mainly suicide, partner violence, housing insecurity, economic vulnerability, and transportation. Also, from the data, approximately 45% of respondents said that they used some sort of care coordination in their screening referral efforts. This could either be a warm referral in terms of getting in touch with other organizations to carry on the process, or use of a tech platform to facilitate that stage of connecting patients to resources and services that they need. So these are all of the challenges that, for those of you on the call who participated in these focus groups, mentioned were barriers to screening or referral efforts. And we're not going to go for all of them, but I'm certainly going to highlight from a content analysis perspective, the most common. And so as you can see, the responses were very varied. And I will give you about a couple seconds to just look at it. But we're seeing that there are many issues which deter or inhibit optimization of screening efforts. And when we looked closer at the data, we saw that some of the main challenges were clinic characteristics. And when we talk about clinic characteristics, we're talking about staffing needs, volume, lack of support. It could also be clinic culture in terms of, is there a sense of willingness, enthusiasm, apathy to moving screening efforts along? And that's what we mean by staff culture. So 10 out of the 22 respondents said that clinic characteristics were a barrier. And one participant said, if the clinic becomes very busy, they may ask the question to the patient instead of giving it to the patient in the paper format. And of course, that becomes challenging because we know that in the verbal format, the patients really don't express it. They're like, yeah, no. And so the volume of the clinic, it does get missed if there are a lot of people waiting. And this is just one of many responses similar to these participants who stated this. Second, COVID-19 impact on screening was a huge barrier that we saw from our respondents, with one participant saying, we've seen an increase in clientele demand than what we've ever seen specifically during COVID. With our resource partner network, yes, we've been able to fulfill and meet the demands, but there have been some hiccups in terms of, kind of coordinating logistics at some point in time. And so in addition to that, one of the more common responses that we saw fell in line with participant LH, who said that just not being able to be in the clinic, having loss of access was definitely a huge challenge. And with that, we're dealing with vulnerable populations, and many people are economically vulnerable, and that resulted in lost phone numbers, the ability to follow up with patients and clients to get them the resources that they need. So COVID really hit organizations really hard this year in terms of screening and referral efforts. Two other themes that we saw across the various codes had to do with language and cultural barriers. And number 3 is huge. So documentation status prohibited a lot of potential participants, clients, patients' clients to get access to much needed resources, be it SNAP or WIC. And that is really a challenge because the patient load, as I said before, during the time of COVID, as we are in now, keeps getting higher. So if your population is not eligible for these resources, it just creates further further gaps in health inequity and access to much needed resources. And lastly, patient disclosure based on screening methods. Now pay attention to that. This is huge. We're seeing a lot of respondents for this say that doing it face-to-face sort of makes the rate of disclosure less likely. So in this participant's case, they're saying, we are not even close to what we're seeing within the community. And for our health advocates team, we're getting 45%. So that's ridiculously huge. Response bias is definitely real. And so integrating e-screeners into how we address screening efforts is going to be huge moving forward. In terms of facilitators, we also saw a huge spread around that. But what stood out the most was the need for routine staff training and education, being culturally sensitive and aware of your population, and just having access to care coordination resources. So as we think about the CIE and the work of the collective, number 3 particularly resonates well. And PJ says, we're in the process of implementing a care coordination platform. I think we do see the value. Having X number of care coordinators would be wonderful, but we know that's not sustainable or actionable at that level. So seeing where the technology can drive the warm handoff would be the way to scale this effort for sure. But also doing so with a certain level of cultural sensitivity in mind. We know that many of our partners and the organizations that are currently within the collective work with populations that come from very varied backgrounds, speak multiple languages, represent multiple countries. So definitely when we talk about the Houston Food Bank, Brighter Bites, Legacy, Hope Clinic, and all the different ones, they have multiple people who speak multiple languages. So that's definitely helping address food screening and referral efforts across the greater Houston area. So to all of you who are engaging in these efforts and being mindful of your population, kudos to you, doing a great job there. So taking what we've learned, how can the collective drive change moving forward? And these are responses only from bucket 1. So this will continue to evolve. But what we're seeing from respondents is that the collective providing this sort of network to help facilitate collaboration opportunities is going to be good as it informs best practices moving forward. And what that simply means is that people within the collective can lean on the support of other organizations to know what's being done, so you're not essentially reinventing the wheel. Secondly, a resource directory. What's being helpful is getting to know people in here that have interest in food insecurity and their approaches. We have a lot of nurse case managers and social workers, but there is no real resource directory that someone is keeping up on a regular basis. And so that's going to be helpful when we talk about the CIE and also that resource sharing capacity. The collective is at the fore in driving this type of change. And lastly, circumventing challenges in care coordination. We know that care coordination takes a lot of work. And with building the CIE, we know it's going to be costly. And we were reminded of that by participants within the focus groups. And so just a little bit of caution is that strategically thinking about how we're going to move forward in this space while we continue to do the work is something that we're going to continuously keep at the front of our minds. And lastly, the inclusion of an integrated focus on upstream factors. When we go back to the framework, this is a huge piece, guys. The fact that people are making mention of the need to talk about the systems-wide approach to not just addressing food insecurity for the provision of resources, but also going upstream. So TVO said, when you talk to people, they're doing the absolute best they can with what they had. And certainly if we talk to the community, they will tell you that as well. It's not just the poverty things, it's sometimes geography, cultural, or education level. So I think making sure we collaboratively continue that conversation with the community voice work group and other work groups are doing phenomenal work in this space. We can continue to learn so much more about the issues facing our community and how we can drive change in reducing health inequity across the greater Houston area. Thank you.
Thank you, Dr. John. So many great things there. We are getting very close to the end of time. Suzanne, can I give it to you for one moment for mental health? And then we've got our guest speaker who's going to just give us highlights, and then we will look to come back for a deeper update from the county in January at our next collective meeting.
Okay, so it's a pleasure to be with all of you today. I am the co-chair along with Alejandra Posada, who could not be here today, of the Mental Health and Substance Use Work Group. We are brand new to the collective. We've had 2 meetings. We launched in September. And the basis of this is to bring mental health and substance use into the conversation across the collective's efforts. And we are working in partnership with the Network of Behavioral Health Providers, which is an organization of behavioral health leadership in Houston that already works in the area of policy and care coordination and education in our community. So we're grateful to be in partnership with them and Andrea Usanga. So if you look at this graphic really quickly, mental health and substance use falls along a very big spectrum and how it presents to the individual and the impact on the community. And so we're looking at the intersection between health equity, the social determinants of health, and the actions of the work groups themselves. So our strategy is to have representation on all of the work groups for mental health and substance use. And if you think of our framework, the drivers of health, we fall from the societal values, the stigma associated with mental health and substance use through to the policy, the social determinants of health or living conditions, and then the behaviors and outcomes. So we launched, we had 40 people show up to our first meeting. Many of them have work experience, interests, they're part of coalitions, or they have lived experience with mental health and substance use. And our next steps are to define our purpose and to set up our goals. So it's a pleasure to represent this for the collective, and we look forward to working with the work groups, the leadership, and the members of the collective as well. So thank you.
Thank you so much, Suzanne. I know it's great work, and sorry we ran out of time. Leah Barton, please join us. We'll give you a few moments, and I know, again, this is a lot of great information, so we'll look for an opportunity to bring this back to the collective as well.
Thank you, and good morning, everyone. Thanks for all of your hard work. Excited to share just a little bit about our Harris County investments through American Rescue Plan Act funds. And I see a lot of familiar names on the call. Some of you will have seen this through GHP, but We have made some progress since then. We are super lucky to be the recipients of $915 million in coronavirus local fiscal recovery funds. We have between now and the end of 2024 to obligate them. And, ARPA really set out 4 primary potential uses of funds, the most important of which is responding to the public health emergency, in which we still are, and its negative economic impacts. So that's really where we're putting our focus. You flip forward. Commissioners Court has established 4 priorities for the uses of these funds: health, housing, jobs and education, or more broadly, economic opportunity, and county operations to the extent there are some transformational investments we can make there. We do have an equity framework that's guiding those investments. And I would ask that Heidi, if you send that around, I did send that on. I think it's been super useful in helping us not only determine which investments to make, but also determine how to make our projects better. We've had really 2 phases to the work. We started out just by developing and approving some immediate relief projects. I'll show you what those are on the next page. And in parallel, we've been doing some deeper research and gathering input, in as much as this funding is very flexible. We do have some time to use it and want to make sure we're taking the most strategic approach. And so right now we're really at a pivot point where we've launched our immediate relief projects, and we'll actually have our first strategic investment going to Commissioners Court for approval on Tuesday. And if we flip forward, you can see the immediate relief projects. We have over $150 million already obligated to health, vaccine incentives, emergency nursing support. And what's interesting is when we started this effort, we didn't think we were going to invest in COVID. We said everybody had COVID fatigue. We said, COVID really revealed all of the underlying inequities that, all of you are very familiar with and have only been exacerbated by the pandemic. But then Delta hit. So we have allocated some funding toward, vaccine incentives and emergency nursing. But we've also been able to provide some homelessness services. We're currently distributing just direct assistance, just straight cash. Sometimes people just need money. We're about $30 million into that with another $30 million to go. And we have a small business relief fund for which applications just closed. We're initiating child tax credit outreach. That's just massive. The expanded child tax credit, as you know, $3,600, for kids, for little kids, and $3,000 a kid for older kids is huge for people who may not have been filing. And then we do have, very unfortunately, a backlog in our court system that started with Harvey and has continued and only grown worse. So we are allocating funding to help reduce the jail population and get people the speedy justice that they deserve. In parallel, we've still deploying our remaining CARES funding, remaining what we call response and recovery funding, and we have received separate allocations of rental assistance. I'm proud to say I think we have one of the best rental assistance programs in the country. And yet, as you've seen in the papers, we know that our eviction rates are rising despite that help. In terms of how we've kind of gone about the more strategic initiatives, we flip forward. We've gotten input from over 1,000 folks. I see Kara Bias on the call. Kara did some great research for us with that, ALICE population, asset limited, income constrained, employed. So we have a lot of great on the ground insight, and we'll be publishing those findings shortly. We've interviewed many of you in broader stakeholder engagement, and then we've gotten about well over 700 responses to a public survey. Those skewed a little more educated, a little wider than the county as a whole, which is why I think the kind of portfolio approach to input has been helpful. We keep going. I would have loved to let Kara speak to her research. Again, I think we can send this around and you can dig into this, but what we know is people are looking for help with healthcare access. They're looking for support. They're raising mental health at rates never seen before, and struggling with caregiving responsibilities. Those are just a few of the themes that came out in that research. And then very similar themes coming in through the public survey, where people are really again off the charts concern around mental health. And so with that, I'm excited to give you guys a sneak preview. I think it becomes fully public tomorrow when the Commissioner's Court agenda hits. But we have a behavioral health project with the Harris Center that will be our first longer term strategic investment under ARPA. And so again, as we're shifting toward that more strategic work, we have refined the focus areas, where we'll be making investments. I see a lot of Harris County Public Health folks on the call, and they've been working super hard on this Access Harris Coordinated Care initiative, and I believe you'll be hearing more about that at a future meeting. But clearly, one of the things that we recognize is the extent to which all of these are just so interrelated, and so excited to be able to be touching so many of the social determinants. And that's all I got. And we're at 10 o'clock. So if anybody's got questions, I'll drop my my email in the chat. But very happy to have the help of your research and all of your efforts along the way.
Thank you, Leah. Thank you for being with us. Any last minute questions, comments? Well, it's a privilege to work alongside all of you and to continue to do so. For those of you who'd like to join any of the work groups and be a part of these efforts, please do reach out. And we'll be sending out the recording and the slides so we can dive in more, and we'll be in touch. Take care, everyone. Thank you all.
Bye.
Thank you.
Thank you.
Bye.
Well, see you guys.
Thank you.